Hi, I'm Tara Schmidlin, the CPMC genetic counselor. Before you view your results, I want to give you some information about what the results can and cannot tell you. When viewing your results for any condition, it is important to remember that the testing done as part of the CPMC study only looks at disease risk. CPMC test results are not a medical diagnosis. Bladder cancer is a cancer that occurs in the bladder, the balloon-shaped organ that stores urine. Most cases begin in the cells that line the inside of the bladder. Bladder cancer is one of the most common cancers in the United States. Bladder cancer occurs most commonly among Caucasian men, and the risk of developing bladder cancer increases with age. 1 in 42 individuals will be diagnosed with bladder cancer in their lifetime. Fortunately, most cases are detected early and at a highly treatable stage. The cause of bladder cancer is unknown. Risk factors for bladder cancer include being male, Caucasian ethnicity, increasing age, smoking, history of chronic bladder inflammation, personal history of bladder cancer, family history of bladder cancer, and genetics. Exposure to the following has also been shown to increase the risk of bladder cancer: parasitic infection, specifically the schistosoma hematobium parasite, a common cause of bladder infection in the developing world, radiation, chemicals used in the manufacturing of dyes, rubber, leather, textiles, and paint, arsenic, the anti-cancer drug Cytoxan or cyclophosphamide, and the diabetes drug Actos or pioglitazone, which has been found to increase the risk of bladder cancer among individuals who have taken it for more than 1 year. We mentioned that genetics are a risk factor for bladder cancer. The majority of bladder cancer cases are caused by a combination of multiple genes, lifestyle factors, and the environment. It is estimated that about 7% of the risk of bladder cancer in the Caucasian population is due to differences in genetic risk factors, while the remaining 93% of the risk is due to differences in non-genetic risk factors like smoking, radiation, or chemical exposure. Signs and symptoms of bladder cancer may include blood in the urine, where the urine may appear dark yellow, bright red, or cola-colored, painful urination, frequent urination, pelvic pain, and back pain. Talk to your doctor about any symptoms you may have. Make an appointment with your doctor if you have blood in your urine. It is not possible for bladder cancer to be diagnosed by genetic testing. Bladder cancer must be diagnosed by a urologist using urine tests, imaging tests, cystoscopy, and biopsy. Since the cause of bladder cancer is not well understood, there is no known way to completely prevent bladder cancer. The following steps may help lower your risk of developing bladder cancer. Don't smoke, drink plenty of water, eat a diet rich in fruits and vegetables, and use caution when working with chemicals. Now let's talk specifically about the CPMC results and genetic risks for bladder cancer. Studies have shown that a particular genetic variant called RS9642880 is associated with an increased risk of bladder cancer in people who have 1 or 2 copies of this risk variant. This variant is relatively common in the general population. About 70% of the Caucasian population has at least 1 copy of the risk variant. Remember that we all have 2 copies of every gene. We inherit 1 copy from our mother and 1 from our father. This means that for every genetic variant result the CPMC study looks at, you can have either 0, 1, or 2 copies. Your CPMC results will tell you how many copies of this risk variant you have. Your bladder cancer results tell you about the impact of a risk variant on your risk to develop bladder cancer. Having 1 or 2 copies of this risk variant increases your risk of bladder cancer compared to people who have 2 copies of the non-risk genetic variant. Having 2 copies of a non-risk variant means that your risk to develop bladder cancer is lower compared to people who have 1 or 2 copies of the risk variant. Remember, bladder cancer is a complex disease, which means that it is caused by a combination of variants in multiple genes and the environment. No single genetic variant causes bladder cancer, so no single genetic variant will completely predict your risk for bladder cancer. Results of CPMC testing alone do not diagnose bladder cancer or rule out the chance of developing bladder cancer in the future. Genetic variant information can help estimate your risk of bladder cancer. However, other risk factors, like your family history or lifestyle, may have a greater impact on your risk than any individual genetic variant. We may learn of other genetic variants that influence your risk of bladder cancer in the future. As we learn more, your estimated genetic risk for bladder cancer may change. We'll keep you updated on changes through the CPMC web portal. For more information, consider sharing your CPMC results with your healthcare provider. You can also contact a CPMC genetic counselor, read information on the CPMC health condition page, or attend a CPMC educational event.